Hey everyone, welcome back to Bone Graft Academy. Today we're going to talk about how to tell if a bone graft may be failing, and just as importantly, how to tell the difference between normal healing and an actual problem. First, let's start with something reassuring. Most bone grafts heal successfully. True graft failure is uncommon, and when problems do occur, they're usually manageable, especially when caught early. The key is knowing what's normal, what's expected, and what should prompt a call to your dentist. Right after a bone graft, some discomfort is normal. Swelling, mild pain, and slight bruising during the first few days are expected parts of healing. These symptoms should gradually improve each day. That downward trend is the most important sign of healthy healing. By the end of the first week, swelling should be significantly reduced. Pain should be mild or gone entirely. The gum should look pink and closed, not red or inflamed. Even if the area still feels tender, it should feel stable and calm, not worsening. Now let's talk about signs that may indicate a problem. One of the most important warning signs is pain that increases instead of decreases. If you feel sharp, throbbing, or worsening pain after the first several days, that's not normal. Healing discomfort fades over time. Pain that intensifies can indicate inflammation, infection, or instability in the graft. Another sign to watch for is persistent or worsening swelling. Swelling should peak within 2 to 3 days and then steadily improve. If swelling suddenly increases after it was already going down, or if it becomes firm, hot, or very tender, your dentist should evaluate it. Drainage or a bad taste in your mouth is another red flag. A persistent bad taste, pus, or fluid coming from the graft site can indicate infection. This doesn't mean the graft is lost, but it does mean treatment is needed right away to protect it. Gum tissue opening or exposed graft material is also something to take seriously. Sometimes sutures loosen or soft tissue pulls back slightly. If you can see white or grainy material under the gums, call your dentist. Small exposures can often be managed easily, but ignoring them can lead to bigger issues. Another sign is mobility or looseness in the area. A bone graft should feel stable. If it feels soft, spongy, or like something is shifting under the gums, that can interfere with healing. Movement prevents blood vessels from forming properly, which slows bone regeneration. It's also important to understand what is not a sign of failure. Mild soreness weeks later. Occasional sensitivity. A feeling that healing is slow. These are usually normal. Bone heals quietly and invisibly under the surface for months, even when everything looks fine on the outside. That's why dentists rely on imaging. X-rays or 3D scans show whether new bone is forming properly. A healthy graft appears dense and uniform. If your dentist says the graft needs more time, that doesn't mean it's failing. It usually means it's still maturing. So what happens if a graft truly isn't healing as expected? First, your dentist will identify the cause. Is it infection? Poor blood supply? Movement? A systemic health issue? Once the cause is addressed, the solution is often simple. This may include antibiotics, improved oral hygiene, additional healing time, or a small supplemental graft. In some cases, the graft is removed and redone once the area is healthy again. The important thing to remember is this. A bone graft is not a one-chance procedure. If the first attempt doesn't integrate perfectly, it can almost always be corrected. Dentistry today has multiple tools, biologics, membranes, PRFA, and refined techniques that make second attempts very successful. To summarize, a bone graft may be failing if pain worsens, swelling increases, drainage develops, the gums open, or the graft feels unstable. Slow healing alone is not failure. Most issues can be corrected easily when addressed early. If something doesn't feel right, trust your instincts and call your dentist. Early evaluation protects the graft and improves long-term success. With proper care, monitoring, and patience, even complicated grafts can heal into strong, healthy bone that supports implants for decades. If you found this video helpful, make sure to like it, subscribe to Bone Graft Academy, and share it with someone recovering from a bone graft or preparing for implant surgery. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.